Hello everyone, and welcome to Inside Healthcare. Every 3 minutes in this country, someone dies of a stroke. Now help is as close as your community hospital, like St. John's Hospital, where thanks to major advances in telemedicine are bringing leading neurologists and specialists virtually right to your bedside, whether you're in the Twin Cities Northeast Metro or up north at your cabin, and the neurologist and specialist treating you is in downtown St. Paul. Here's a look at Telestroke.
And was your vision okay?
I think it was.
Elaine, can you tell me what month it is?
May.
All right, we're going to go through a little bit of an examination. So first I'm going to focus in on your face real closely. I want you to take your glasses off for me, okay?
Okay.
Now close your eyes really tight. Good, good. Okay, Elaine, now I'm going to have you try and raise your left arm up to the count of 10, straight out like an arrow, okay? The left one.
Telestroke allows patients in rural Minnesota to get the same good quality of treatment that we are able to offer at our tertiary center in St. Paul.
I guess I have to.
I'm a physician in the hospital that I'm working with. I'm credentialed at that hospital, and I'm helping to make the decision as though I'm there.
Dr. Jessen, let's just check the sensation.
I have to say it's been tremendously helpful. It is so nice to be able to have a neurologist right there to consult with and to go over the nuances of each case and make the critical decisions about what is the best course of action to take for a particular patient.
Typically, a patient comes into their local emergency room and they're identified as a stroke patient with a focal neurologic deficit and a time of onset that might qualify them for interventional treatment or IVTPA.
Stroke code, ER.
A code is called within the hospital, and a team of people from that hospital arrives and they call the Telestroke physician at the same time and determine whether or not we're going to go forward with the stroke code. And then the Telestroke physician connects via video to the rural hospital and starts interacting with the rural physician or nurse and the patient. Very often by the time I'm connecting to the remote hospital, the patient has gone through the early stages of their stroke code at that hospital. Their blood has been drawn, they're sent to CT, and I might be talking to their family and getting history. Then the patient arrives back from CT. We might go over the CT scan films by a video at that time to make certain that there's not a hemorrhage. And we initiate the treatment by ordering the drug and getting it going. And meanwhile, we're making a connection with flight service to bring the patient for aftercare at St. Joseph's after the treatment.
I get a call, I call, they're hooked up within a couple of minutes with them, with their ER doctor usually, and we're discussing the case, and we can authorize, hook up the camera, look at the patient, make sure it's a stroke, and get CPA to them within a half an hour. So really amazing, and they're out in Glencoe or Redwood Falls.
The combination of us being able to look at the imaging, the CAT scan or the MRI, and the combination of us being able to look at the patient, we believe translates into better and more accurate diagnosis. And so the benefits to the patient are that we can make decisions that are more accurate for those patients regarding transfer, which can be very expensive, and we want to make sure that we utilize those resources appropriately. Also, we can make decisions often that might indicate that we don't have to transfer the patient, and so we can keep the patient on site. And again, and that is often a better utilization of resources.
And time is of the essence when you're dealing with this kind of a thing. The clock is always ticking, and there's often some critical decisions to make that, those of us in primary care aren't as comfortable with those decisions as the neurologists are. And out here, you just don't have a neurologist available all the time, so it's great to have the video hook up, have the neurologist be able to look at the patient with you.
All right.
I think the response that we have had, the cooperation from Dr. Hansen and her colleagues has been tremendous. They've made it very easy to participate in this program.
When I got started, they could hardly lift my arm. And then when they were starting it, I could finally lift my arm like that again.
Elaine did remarkably well. She started to improve during the infusion while she was still at Glencoe. And by the time she got to us, she was close to her previous clinical baseline. She did not require any additional treatment at St. Joseph's. We cared for her afterwards in order to make sure that she didn't suffer any serious hemorrhagic complications. And she was able to get discharged just a few days later and get back home.
And we're very pleased to have with us Dr. Sandra Hansen, who you just saw in the video. She's a vascular neurologist with the National Brain Aneurysm Center and with the Health East Telestroke program. So thank you so much for being with us.
Thank you for having me.
You know, I find it just absolutely fascinating that you're able to treat these patients, diagnose them within minutes of their symptoms, within minutes of them getting to their community hospital, and in some cases stopping the stroke before it does devastating damage, disability, and even death. It's got to be really rewarding for you to be able to help so many patients across the state like that.
Well, it's fantastic, and you know we really have been able to recognize the utility of the service right away. A California group doing a similar kind of work demonstrated that if they were to be contacted by phone, the same stroke specialists would not be able to diagnose as readily or treat as many patients because of the concerns about whether or not they were correct about the diagnosis.
And we heard Dr. Madison say sometimes within half hour you're able to do all of this?
That's right.
Unless?
Yeah, it's our goal to be able to connect up, to be in that emergency room within 5 minutes of being called. And we are a part of that hospital, so we're credentialed at that hospital. We're leading the stroke code in the emergency room. And our goal, if we get in within 5 minutes, we know we can potentially get the drug in within 30 minutes.
What about security? I know I Skype with my daughter oftentimes. It reminds me a lot of that, but this is really secure site that you're working with.
Of course, yeah. It's both video and audio, and it's secure connection, HIPAA compliant, so protecting patients' privacy. But it's amazing how much of a face-to-face interaction it truly is. It feels very much like being at the bedside. I'm able to take my own history, do my own examination, and come to a conclusion much faster and more accurately than I otherwise would.
You've added a number of hospitals, just St. John's Hospital, Woodwinds in Woodbury. What are some of the other hospitals that now have Telestroke available?
Well, the program actually started about 5 years ago, and then Health East took it on 2 years ago. And we started with rural sites. Glencoe is our very first site, and Alexandria is going to be our newest site. We also serve at Redwood Falls, Granite Falls, and St. Francis in Shakopee. But across our system at Health East, St. Joe's, we connect during evenings and weekends there to make sure that we get into the code as quickly as possible, and then also at John's and Woodwinds recently. Wow,
just amazing. So maybe you can step back just a little bit. What exactly is a stroke for people that may not exactly know what it is, and then what would be the warning signs of it?
Well, the kind of stroke we're talking about is an ischemic stroke, where usually there is, or almost always, there's clot playing a role in blocking a blood vessel and limiting oxygen, limiting blood flow to a part of the brain. And so as soon as that blockage occurs, the symptoms will start, and that will be the first warning that you have a problem. The symptoms will depend on where in the brain the blockage exists, so it might be a speech problem, it might be weakness on one side of the body, it might be numbness on one side of the body, sudden onset of dizziness or imbalance could also be a symptom. More often, when you're dealing with the other kind of stroke, hemorrhagic stroke, where you bleed into the brain, you would experience something like a sudden severe headache.
Oh, so, and if you have these symptoms or these warning signs, you need to call 911 immediately.
Absolutely. We can do on our side what we can in order to speed delivery of treatment for you, but we can't help you out in the field. You need to be the one to call 911 or call 911 for your family member if you see this happening.
And I think we've heard the myth where it only happens to the elderly, but it can happen to anybody at any age. Are there certain populations or individuals who are more at risk for a stroke, and is there anything you can do to prevent them?
Well, age is certainly a risk factor, so it increases as we age. However, a third of the strokes occur in people under the age of 65. So very important to be aware of what the symptoms and signs are, even in younger people. The risk factors for the traditional causes of stroke, atherosclerosis, plaque buildup in arteries, that sort of thing, would be things like high blood pressure, high cholesterol, diabetes, obesity, and all of those things you can look at as things we might remedy with our own behavior, diet and exercise, for example.
And you can, I think I had read that you can prevent something like 80% of strokes by taking these lifestyle changes. And
it's a very important factor. Hypertension, again, probably being one of the biggest risk factors for stroke.
And there's no signs or symptoms for hypertension for the most part?
Well, oftentimes people don't know they have high blood pressure. Occasionally they may have some symptoms, but generally speaking, it's a silent killer.
Back on the Telestroke program, I mean, what do you think about this, to be able to offer this to patients around the state?
Oh, it's a wonderful thing. We know that in the state of Minnesota, we have stroke as a very significant problem. In fact, some of the rural sites are probably the areas where we have a higher stroke mortality. So it's very important that we get this treatment out to the wider community.
And you have that window of opportunity, what do they call it, the golden hour or so, to get treatment?
For intravenous TPA, when we deliver the drug into an IV, 4.5 hours. But even within that 4.5 hour time window, we're losing brain. So yeah, just every 15 minutes that we lose increases mortality by about 5%.
Any final comments about Telestroke or about stroke for our viewers?
Well, I just am very happy to be involved in this. It's a very rewarding experience. If there is anybody who's interested, I'd be very happy to come out and give a talk at a local hospital to describe the service and see whether or not it would be a fit for that particular hospital.
Well, it's really been a pleasure to have you with us today. I know that you have a very busy, hectic schedule, so we really appreciate you taking time.
Thank you for having me.
So thank you, Dr. Sandra Hansen. And if you'd like some more information, you can call 651-232-4528 or visit thebrainaneurysmcenter.org. Still ahead, we're going to be talking about how a trip to your grocery store might help you stop one of the most common allergies. So we'd like you to stay with us.
Thanks. You believe this guy?
Are you trying to start a wildfire?
Sorry. Pass the honey?
9 out of 10 wildfires are caused by humans.
Only you can prevent wildfires.
Well, welcome back to Inside Healthcare. Joining us now to talk about one of the most common allergies is, we're going to be talking about gluten allergies, and joining us is Leanne Grayview, who's been a frequent guest here in the past. She's a registered dietitian at St. John's Hospital. Thank you, Leanne. Mm-hmm. And then also joining us are our good friends from Festival Foods. We have Jason Herfel and Mark Hartman. So thank you both for being with us. Leanne, first of all, maybe you can talk about what are gluten allergies and what would be some symptoms? How do you know if you even have a gluten allergy?
Gluten allergy is an allergy to wheat protein that causes digestive problems, and it's also known as celiac disease. And celiac disease affects worldwide 1 in 100 people. It's really 1 in 130 people statistically. So it's very common that someone might have celiac disease, especially if you're of Northern European descent. and wheat has been part of your diet since you were young. But if you have symptoms such as gas, bloating, diarrhea, or constipation, that would be some visible symptoms of a wheat intolerance, but there's oftentimes sort of silent symptoms as well, where you have a malabsorption of key nutrients, and then you end up, as you age, with something like osteoporosis or a low vitamin D count or an anemia.
So how do you know that you have one of these allergies without, I mean,
Well,
the symptoms could be
oftentimes-
a number of things, right?
Right. Oftentimes people present with a lactose intolerance, which is the milk sugar. Then people say, oh, I need to give up milk. And when I visit with clients who tell me they're lactose intolerant, I ask them, once they gave up milk, did their symptoms abate? And oftentimes they still have the GI symptoms. And so then that's when I start to investigate further, because oftentimes people present with a milk intolerance, but it's actually a wheat intolerance that's the underlying condition that hasn't been recognized.
And are we seeing more of it today with different processed foods or things?
You know, researchers are saying there really is a higher incidence when they do research than there used to be, but most of all, they're being diagnosed where you have people that have had celiac disease all their life but never got the diagnosis. They say on average, people go 7 to 9 years seeking a diagnosis for their complaints, and then eventually, if they're persistent enough, they end up getting the diagnosis of celiac disease. And it doesn't require a lot of medicines to manage the disease. It just requires getting rid of wheat protein, which is very prevalent in the diet.
In so many different foods,
Right.
which brings us to festival foods. And Jason, you have at Festival have made the decision to include more gluten-free products. Why did Festival Foods decide to do this?
You know, about 3 years ago, we started getting more and more requests from our customers. And as a small family-owned grocer, you know, we hear a lot from our customers. You know, verbally and online, we get a lot of feedback. And so as the issue became more prevalent and we started hearing of more cases being diagnosed, it just became, you know, very clear that this had to be a part of our assortment to complete your shopping trip. And a lot of what we heard was people came shopping, and if there was one person in the family that needed a gluten-free diet, they needed some place to do all their shopping so they could pick up their gluten-free items for those specific family members that were affected, and their regular items for their diet as well.
And you brought a lot of products with you today. All of these gluten-free?
They are. And as you can see, they're coming from different manufacturers, mainline manufacturers and specialty manufacturers that understand the need for the foods in the daily diet.
And basically, they don't contain wheat or other products then?
Correct. A lot of items, they'll use a rice flour or some other replacement item in order to make the product you know, much better than it was years ago. And the one thing the manufacturers are figuring out is gluten-free products don't have to taste bad. Gluten-free products can really taste good.
These do taste good?
They do.
And Mark, you're with the Hugo Festival Foods, and
Correct.
You carry how many different kinds of products now?
Currently we have about 300 items. It's a growing category. It's growing by leaps and bounds, and we're just trying to keep up with the demands of the customers.
So we're seeing some samples here. What would be some of the other foods that are gluten-free that you carry?
We have some frozen food items that are gluten-free. We've got about 50 items in our frozen food set.
Wow, that's a lot.
Yeah, and a lot of it's, you know, product that you can, it's prepared, so all you have to do is warm it and eat it, so.
You were going to say, Jason?
One of the big things is, you know, bread replacement, you know, for people that are suffering that their diet, you know, if you can't contain wheat. So Sharp products are some of the products that we're carrying, a new Katz bakery line. Some of those things that they're really your favorite items. And like you said, if you grew up with wheat in your diet, you know, from an early age, and now all of a sudden you can't have it, you want a replacement for that. So some of these products are definitely stepping up. Old Dutch just came out with a potato chip now that's gluten-free.
Wow, I mean,
you know.
you wouldn't think potato chips would be like gluten-free, and
Yeah.
and they actually do taste good.
They do. The Honey Dijon is a great product, and as you can see, General Mills with their Chex product is, you know, labeling it now gluten-free. So the manufacturers are doing a better job of labeling their products. They may have always been gluten-free, but for people that are suffering from that, we're seeing it more and more on the front of the package that they're calling that out, so the consumers can easily be, comforted that the food is something they can have in their diet.
So that must be a good thing that you're able to offer this to your customers. I mean, do they say thanks for
I get a number of
these?
customers that comment that they're very pleased how many items that we have to offer them. So.
And another reason that we decided to bring you all on to talk about gluten allergies and gluten-free products is that we have an event coming up that's with Health East and Festival Foods. Mark, you want to tell us about it?
It's a 2-day event. The first one is Monday, May 16th at the Hugo City Hall from 6 o'clock to 8:30, or 6:30 to 8. And then the second event is at the Festival Foods in Hugo from noon to 5, and it's, we're going to have a lot of items there for sampling and a nutritionist to tell us about what's going on.
Right, the nutritionist will be there on the second day to answer questions, and all the vendors will be there offering people to sample their products. On the first night, there's going to be a physician from Health East talking about what is gluten intolerance and what are the signs and symptoms and how it evolves. And then the dietitian will be talking about how to apply a gluten-free diet in your lifestyle. And the target audience is not only people who know they have gluten intolerance, but for those people who feel like, oh, these symptoms are adding up. I have a milk intolerance, or I have a low iron count. I've just been told my vitamin D count is low. I've got fatigue, and I sometimes have itchy skin rashes. These sort of things that might add up to gluten intolerance, and you want to find out more.
Mm-hmm. And why did you decide to hold this event, or this 2-day event? Jason?
We continue to get requests, and Health East contacted us, and they wanted to do another session. Health East has a clinic in Hugo as well, and so our store paired up well to be right there. The city of Hugo is doing a big push on health and wellness, so it was really just a very natural fit. And Kay Baker from Health East was instrumental in pulling all the pieces together and getting us connected, so that it really is a full package. So if you think you have an issue, you can come and find that out.
Or if a loved one has an issue.
Yes.
Right. Some people know they have it, but they want to get their loved one to consider that they might have it rather than being in denial about it. A lot of people are in denial about it. But the advantage is that once you get off the wheat protein, which is the allergen or the irritant into your digestive tract, now you feel better and you have a much more higher quality of life.
That's amazing that just something as simple as just changing your diet, eating different foods can basically cure your allergy.
Exactly.
Make the symptoms go away. Final comments about gluten-free products or about the gluten allergies that our viewers should know about?
Well, I find that patients need to be persistent. As I mentioned, the diagnosis goes a long time unchecked. So you have to put it together and then be your own best advocate in trying to get a referral to the GI doctor or running a blood test to see if possibly that might be your ailment.
Mark?
Just I hope everyone comes out to the event for Festival Foods up in Hugo.
And if they want to register, they need to call Kay Baker at 651-232-3035. And Jason, final comments.
And I think if you have this allergy, that you should make sure you try out the products. And definitely get in contact with your local grocer and let them know that you need these products and you need them in your basket. So you should demand that as well. So stay persistent. So it's a good thing.
Well, it's a good thing to have you all here joining us today, talking about this important issue that affects a lot of people. So thank you, Jason, Mark, and Leanne.
Thank you.
Appreciate it. And we appreciate you joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.